This is an analysis for the community of Haines City presented to you by Sulema Jensen. In this PowerPoint, I will be presenting the history of Haines City and how it has evolved over time. An analysis of the community describing their structure, population, health, environment, government, and public policy will be given. It will be important for the analysis to prioritize problems within the community and global community issues. Haines City was created in 1885 after the South Florida Railroad reached the region. Before the city had any railroad station, it was known as Clay Cut. The residents of the city convinced the railroad company to build a station in exchange of naming the city after a railroad official, Colonel Henry Haines. In 1914, Haines City was incorporated under the general status of Florida as the town of Haines City. The Ringling Brothers and Barnum and Bailey Circus was one of the attractions from 1974 to 1986. Today, that area is a shopping complex named Posner Park. Haines City is located in Polk County, Florida, and is the third most populated city in the county. The government of Haines City operates a commission manager plan who provides the city's services like public safety and sanitation. In recent years, Haines City has become a location with an exceptional fast residential and commercial growth, mainly because its location is few miles from Disney and Orlando area. As of 2014, the population of Haines City was 22,072. Structure. We can find diverse neighborhoods from very low-income properties to upscale ones. Availability for low-income housing for disabled seniors and low-income families in different areas of the cities is subsidized by the Department of Housing and Urban Development, but these ones are privately owned. Other programs like Section 8 are available. Haines City has a variety of schools from pre-K to high school. No vocational schools, colleges, or universities were found within the city limits, but they are nearby. The continuous rapid growth of population will eventually create an overcrowding problem in the schools. A negative effect from this can be decreased learning due to poor teacher-student ratio, and this can lead in the future to lack of employment opportunities, decreased income, increase in poverty, and decrease in health. The city of Orlando also has a steady growing population, but recently they allocated a budget of $562 million for new schools and renovations. Public library is available for the residents of Haines City, and the location is also utilized as an informational venue for preschool education. Haines City has several community centers that are available for the residents for any special events, and with these centers, they promote community involvement and health promotion through diverse programs by offering sport and recreational activities for the residents. In 1994, downtown Haines City Commercial District was designated as a historic district. Some of those landmarks are the Old Haines City National Guard Armory and the History Polk Hotel. Haines City has many businesses for the consumers. The cost of food is comparable or slightly less than other cities. No organic stores were found, but they have a great alternative is that every Wednesday many vendors reunite in the heart of the city to offer fresh products and organic food options. This is comparable to other cities like Winter Garden, which offer farmer markets on selected days of the week. Population. Haines City's biggest difference in population is among children in the age group of 5 to 9 with 11.6%, which is almost double the number in Polk County and the state of Florida. According to the CDC, the leading cause of death for this age group is unintentional injuries. Caucasian population is 53%, while 38% are Hispanics. This represents a big difference in the percentage for Polk County and the state of Florida, where the Hispanic population is lower. According to the National Center of Children in Poverty in Florida, for the year 2013, Hispanics had a 33% of young children living in poor families. This becomes a health concern because the percentage of Hispanic children in Haines City is high, and it's also reflected when we see that Haines City community has a 25.6% of families receiving public assistance, which is almost double of the amount that Polk County and the state of Florida have. In education, 50.9% of the population in Haines City are 9th grade or below, and again, this indicates a higher population composed of children. 6.8% of the residents have an associate degree, and 10.2% have a bachelor's degree. The percentage is less than Polk County and Florida, but with a minimal gap in between. For disease and health, we move into Polk County for information since no data was found in Haines City. STDs is at the top of the communicable disease with 3,302 cases from 2012 to 2014, and the population between ages 15 to 24 account for about 20 million new STD infections in the United States each year, making this a challenge and a major health concern. Leading cause of death for Polk County was heart disease, while the leading cause of death in Florida is cancer. Factors that contribute to these diseases are unhealthy diet, obesity, lack of activity, and smoking. Health-related resources. Haines City has one hospital, which is Heart of Florida Regional Medical Center within the city limits. They have two public clinics that are either free or payment is based on an income scale. Lakeland, which is a neighboring city, have 7 clinics. However, their population over there is higher. We have several nursing home facilities within Haines City, and they are similar to any other cities like Orlando or Lakeland. However, the volume of the locations they have might be greater because the difference in population size is greater. We have no shelters in Haines City, but we can find about 5 shelters within 20 miles of distance. A health resource nurse for this community needs to be aware that poverty for Haines City not only affects individuals materially, but on a psychological level too. Problems like educational difficulties, food insecurities, inadequate housing, and violence are seen often. Restraint from resources are on the rise, and this is becoming far too common, which in turn stop the progress of a general social change. In regards to access, Haines City residents can receive medical care from hospitals located within the city limits. For acceptability and affordability, hospitals will accept anyone regardless of insurance, but the continuity of care will be compromised due to lack of insurance, socioeconomic status, transportation, and lack of resources. Many primary care doctors accept Medicare and Medicaid, but because appointments are not readily available, patients end up returning to the emergency room. For Healthy People 2020, the objectives I chose for the community of Haines City were based on the population needs. These topics are reduce the overall cancer death rate, and we can do that if we increase the health knowledge that focuses on prevention and primary care while facilitating access to service. The second was reduce coronary artery disease, and this is probably the community objective that can have a better probability to be modifiable because we can educate everybody about changes like healthy eating habits, physical activities, and managing stress that can reduce coronary artery disease. Third, I chose increase the proportion of elementary, middle, and senior high schools that can provide comprehensive school health education to prevent health problems and unintentional injuries. And I chose this objective because in Haines City, the children population is greater and the leading cause of death is unintentional injury. Environment. The environmental capabilities of Haines City from the police department, fire department, parks and recreations, and public works are adequate compared to major cities because the residents are provided with the same services as any other major city in Florida. For this analysis, I did not find any environmental problems for the community. However, in order for the area to continue a healthy growth, the right resources and evolutionary projects need to take place to avoid any future difficulties. The quality of the resources will depend on the restoration, maintenance, and developmental planning. Government and public policy. Haines City has 5 city commissioners that include the mayor and a vice mayor. The city also has their city manager and 2 assistant managers. Other positions are chosen like city attorney and city clerk. Officials are accessible to residents of the community, and I was a witness of this recently because while I was at my daughter's induction into the National Honor Society for her high school, the assistant city manager was present. She was part of the presentation for the inductees and also was available for questions after the ceremony. Agenda meetings are posted on Mondays before the meetings, and these meetings can be listened to live. The community budget is encompassing all aspects needed for the continuous development of Haines City. An example of this is that part of the community budget is focusing on keeping up with the growth of the city to provide residents with a comprehensive and strong parks and recreation master plan. Community needs. In order that I chose these objectives are because of the needs of this community in Haines City. As evidenced by prior information given, Haines City has an above normal poverty level compared to Polk County and Florida State. And unfortunately, that impact of poverty has serious implications in this population's health. The situation is directly connected with healthcare accessibility. More studies involving public health nurses is needed to understand child and family poverty in order to advocate for new strategies to improve healthcare in general. Early screening for cancer and heart disease. I chose that because of a poor accessibility to follow-up care with primary care physicians. Early screenings for the leading cause of death is delayed and emergency rooms are becoming overcrowded. Then I chose homeless shelters because we don't have any shelters within the community, and because of the higher poverty level over there, if we happen to have a natural disaster, this is going to become a problem. And then last, I chose future overcrowding in schools because of the rapid growth that we're having. Eventually, it's going to create a problem sustaining a normal ratio between the student and the teacher. A prominent global community issue is poverty, which is also a major concern for Haines City. And surprisingly, this it's also a higher poverty rate for United States compared to countries like Canada, France, and United Kingdom. Other countries like China invest in agriculture to reduce poverty. Canada, along with the United Nations, believe that in order to end poverty, we have to provide quality education, access to healthcare, water and sanitation, economic security, and children participation in active roles within their community. Ways that we can deal with this issue to have any changes, it's improving jobs, supporting pay equality, establishing flexible work schedules, providing affordable and quality childcare, among other ideas that will expand opportunities and increase economic security. And how can the community health nurse intervene? Well, community health nurses' overall goal should address new ways to create programs and promote multidisciplinaries and collaborative partnerships with the purpose of improving overall health while identifying critical needs like poverty for the community. It is of great importance for these nurses to help promote new health policies that reduce health disparities for an overall successful outcome of community in general.